Are you tired of dealing with the frustrating symptoms of psoriasis? Introducing Tremfya Medication, the groundbreaking treatment that is changing the game for those living with this chronic skin condition. In just a short time, Tremfya has become a life-changing solution for psoriasis sufferers worldwide. With its innovative formula, Tremfya offers long-lasting relief from the painful itching, redness, and scaling that accompanies psoriasis. Designed to target the underlying cause of the condition, it works by suppressing the overactive immune response responsible for the rapid skin cell growth. Understanding Tremfya Medication. Psoriasis is a chronic autoimmune disease that affects the skin, causing itchy, red, and scaly patches. It occurs when the immune system mistakenly attacks healthy skin cells, leading to an overproduction of skin cells. This rapid turnover of cells results in the characteristic symptoms of psoriasis. Tremfya, also known as guselkumab, is a monoclonal antibody that specifically targets and inhibits the activity of a protein called interleukin-23, IL-23. IL-23 is an important cytokine involved in the inflammatory response and plays a crucial role in the development and progression of psoriasis. By targeting IL-23, Tremfya helps to regulate the immune response and reduce the excessive production of skin cells. This leads to a significant improvement in the symptoms of psoriasis, including a reduction in redness, scaling, and itching. Tremfya is administered via subcutaneous injections, typically once every 8 weeks after the initial doses. It is important to follow the prescribed dosing schedule to ensure optimal results. The injections are relatively painless and can be self-administered or performed by a healthcare professional. How Tremfya Medication works to treat psoriasis. Tremfya Medication works by specifically targeting interleukin-23, IL-23, an important protein involved in the inflammatory response. IL-23 is responsible for activating specific immune cells called T helper 17, Th17, cells, which play a crucial role in the development and progression of psoriasis. In individuals with psoriasis, there is an overactivation of Th17 cells, leading to an excessive production of cytokines that promote inflammation and the rapid turnover of skin cells. By inhibiting IL-23, Tremfya helps to regulate the immune response and reduce the production of these inflammatory cytokines. By reducing the activity of Th17 cells and the production of inflammatory cytokines, Tremfya effectively suppresses the underlying cause of psoriasis. This results in a significant improvement in the symptoms of the condition, including a reduction in redness, scaling, itching, and overall skin clearance. The efficacy of Tremfya in treating psoriasis has been demonstrated in several clinical trials. In a pivotal Phase 3 study, the majority of patients treated with Tremfya achieved significant skin clearance compared to those on placebo. Benefits and effectiveness of Tremfya Medication. Tremfya Medication offers several benefits and is highly effective in treating psoriasis. One of the key advantages is its long-lasting effect. After the initial doses, Tremfya is administered only once every 8 weeks, making it a convenient treatment option for patients. The convenience of Tremfya extends beyond its dosing schedule. The medication can be self-administered at home, eliminating the need for frequent visits to healthcare facilities. This allows patients to have greater control over their treatment and reduces the burden associated with managing psoriasis symptoms. The effectiveness of Tremfya in improving the symptoms of psoriasis has been demonstrated in clinical trials. In these studies, a significant percentage of patients achieved clear or almost clear skin after receiving Tremfya treatment. Additionally, Tremfya has been shown to improve overall quality of life, including physical and emotional well-being. Furthermore, Tremfya has shown efficacy in treating various forms of psoriasis, including moderate to severe plaque psoriasis and psoriatic arthritis. This makes it a versatile treatment option for individuals with different manifestations of the condition. Potential side effects and precautions of Tremfya Medication. As with any medication, Tremfya does come with potential side effects and precautions that need to be considered. The most common side effects reported by patients include upper respiratory tract infections, headache, injection site reactions, and diarrhea. In rare cases, Tremfya may increase the risk of serious infections, including tuberculosis, bacterial, fungal, and viral infections. It is important to notify your healthcare provider if you experience any signs of infection, such as fever, chills, or persistent cough. Patients with a history of tuberculosis or other chronic infections should exercise caution when considering Tremfya treatment. Additionally, individuals who are immunocompromised or have a weakened immune system may be at an increased risk of infections and should discuss the potential risks and benefits with their healthcare provider. Before starting Tremfya treatment, it is important to inform your healthcare provider about any pre-existing medical conditions or medications you are taking. They will be able to determine if Tremfya is suitable for you and monitor your progress throughout the course of treatment. Consultation and prescription process for Tremfya medication. To start Tremfya treatment, it is necessary to consult with a healthcare provider who specializes in dermatology or autoimmune diseases. They will evaluate your medical history, conduct a physical examination, and assess the severity of your psoriasis symptoms. If Tremfya is deemed appropriate for your condition, your healthcare provider will prescribe the medication and provide you with instructions on how to administer it. They will also explain the potential side effects and precautions associated with Tremfya and address any concerns or questions you may have. Depending on your healthcare system and insurance coverage, the cost of Tremfya medication may vary. It is advisable to check with your insurance provider to determine the coverage and any out-of-pocket expenses you may incur. Success stories and patient testimonials on Tremfya medication. The success of Tremfya medication in treating psoriasis is not only supported by clinical trials but also by numerous success stories and patient testimonials. Many individuals have experienced life-changing results after starting Tremfya treatment, with significant improvements in their skin condition and overall quality of life. Patients have reported reduced itching, scaling, and redness, allowing them to regain confidence in their appearance and engage in activities they previously avoided due to their psoriasis. Some individuals have even achieved complete or near-complete clearance of their psoriasis symptoms, leading to a dramatic improvement in their physical and emotional well-being. The positive impact of Tremfya on patients' lives extends beyond the visible improvements in their skin. Many individuals have reported feeling more comfortable in social settings, experiencing less stigma associated with their condition, and enjoying a renewed sense of freedom and self-expression. Comparing Tremfya medication with other psoriasis treatments. Tremfya medication is a relatively new treatment option for psoriasis, and it has shown promising results in clinical trials and real-world use. However, there are other treatment options available for managing psoriasis symptoms, each with its own benefits and considerations. Topical treatments, such as corticosteroids and vitamin D analogs, are often the first line of defense for mild to moderate psoriasis. These medications are applied directly to the affected areas and can help reduce inflammation and alleviate symptoms. However, they may be less effective for severe or widespread psoriasis. Systemic treatments, including oral medications and injectable biologics, are typically reserved for moderate to severe psoriasis that does not respond to topical therapies. These medications work by targeting the immune system or specific molecules involved in the inflammatory response. Compared to other systemic treatments, Tremfya offers the advantage of a longer dosing interval. While some biologics require more frequent injections, Tremfya only needs to be administered once every 8 weeks after the initial doses. This may lead to improved treatment adherence and patient satisfaction. Frequently asked questions about Tremfya medication. How long does it take for Tremfya to start working? Tremfya medication typically starts to show noticeable improvements in psoriasis symptoms within a few weeks of starting treatment. However, individual responses may vary, and it may take several months to achieve optimal results. Can Tremfya be used in combination with other psoriasis treatments? Tremfya can be used alone or in combination with other psoriasis treatments, depending on the severity of the condition and the recommendation of your healthcare provider. It is important to discuss any potential interactions or contraindications with your healthcare provider before combining treatments. Can Tremfya cure psoriasis? While Tremfya medication can significantly improve the symptoms of psoriasis and lead to long-term remission, it is not a cure for the condition. Psoriasis is a chronic autoimmune disease, and ongoing treatment may be necessary to manage symptoms and prevent flare-ups. Is Tremfya safe to use during pregnancy or breastfeeding? The safety of Tremfya medication during pregnancy or breastfeeding has not been established. It is important to consult with your healthcare provider if you are pregnant, planning to become pregnant, or breastfeeding before starting Tremfya treatment. What should I do if I miss a dose of Tremfya? If you miss a dose of Tremfya, it is important to contact your healthcare provider for guidance. They will provide instructions on how to proceed and may adjust the dosing schedule accordingly. Conclusion: the future of psoriasis treatment with Tremfya medication. Psoriasis can be a challenging condition to manage, but Tremfya medication offers hope for those seeking relief from its symptoms. With its innovative approach and proven efficacy, Tremfya is transforming the lives of individuals living with psoriasis. By specifically targeting the underlying cause of psoriasis and regulating the immune response, Tremfya provides long-lasting relief from itching, redness, and scaling. Its convenient dosing schedule and self-administration options make it a practical treatment choice for patients. While Tremfya is generally well tolerated, it is important to be aware of potential side effects and precautions associated with the medication. Consultation with a healthcare provider specializing in psoriasis is crucial to determine if Tremfya is suitable for your specific condition. With numerous success stories and patient testimonials, Tremfya Medication is giving hope to individuals living with psoriasis. Experience the freedom of clearer, healthier skin and embrace a life free from the constant frustration and discomfort of psoriasis with Tremfya. Thanks for watching.